Everyone, welcome to Rehabilitation Sciences Group YouTube channel. And today we are here with another very interesting topic, cardiovascular adaptation to sustained aerobic exercises. And we are privileged to have with us Dr. Jasmine Kaur Chawla. She's assistant professor at MIT University. And we have Dr. Sagun Agarwal as a moderator today, and he'll be moderating the session. Before we start that, we would like to take the consent of Dr. Jasmine. We are going live on your lecture, ma'am. So do you consent to us to, Dr. Sagun, you can just, Dr. Sagun, you can start the session now.
Good evening, everybody. Welcome to the Rehabilitation Science Group. Today we are having privilege to have Dr. Jasmine Chawla with us. She is Masters in Sports Medicine from GNU. Guru Nanak Dev University. She is PhD from the same university, GNU University, and she is having more than 5 years of the academic experience. Presently, as Dr. Ram has told, she is working as an assistant professor in MIT University. She is a very good sports physiotherapist, and she is having a few projects from the government and the private companies also, and she is having a good interest in the research, and she wants to pursue more and more projects should be coming up for the physiotherapy. Thank you, Dr. Jasmine, for coming on the channel and sharing your this. Thank you.
Thank you so much, sir. So, first of all, I would like to thank the team of Rehabilitation Sciences and the moderators of today's session, Dr. Dharam and Dr. Sagun, for giving this beautiful opportunity to share my views and my knowledge with the listeners over there. So thank you so much, sir. And I hope I'll be able to justify your expectations today in this session. So without wasting much of time, I would like to introduce you to today's topic, that is cardiovascular adaptation to sustained aerobic exercises. So first of all, good evening to all listeners. I hope you are all staying safe and are healthy. So as you know, regarding this topic, it has been established that in the literature review, the aerobic exercise training leads to cardiovascular changes that significantly increases the aerobic power, which further increases the endurance performance. So today's objective of this lecture will be to understand how this adaptation and what level of adaptation occurs with different sustained aerobic exercises. So let's first appreciate the nature and appreciate the heart who is responsible for this cardiovascular adaptation. That is the mighty and the powerful heart. Heart which is not longer than a fist, yet has incredible power inside. In 1 minute, the heart can pump blood to every cell in the body, and in 24 hours, it pumps 2,000 gallons of oxygen-rich blood through 60,000 miles of branching blood vessels, which is a long way to go. So first, let's have a brief insight on the heart anatomy. Let's understand what is the blood supply to the heart. So the main supplier to the blood is aorta, which is further divided into right coronary artery and left coronary artery. Right coronary artery, in simple terms, supplies to the right side of the blood, right side of the heart, whereas the left coronary artery supplies to the left side of the heart. Left side of the heart is slightly larger and more muscular because it pumps the blood to the rest of the body, whereas the right side of the heart is slightly smaller as it only pumps blood to the lungs. So now let's understand what effects of exercise happens on the cardiovascular system. On a broad spectrum, the effects are divided into 4 aspects, that is heart rate, blood pressure, cardiac morphology, and serum lipids, which I will be dealing today in detail. And in brief, if I have to further bifurcate this response and adaptation, it can be divided into 6 components, that is heart rate, systolic volume, cardiac output, blood pressure, blood flow, and cardiac morphology. So let's first start with the heart rate. Heart rate in normal human person ranges from 60 to 80 beats per minute. whereas in middle-aged person, it ranges from 100 beats per minute. In allied people, it ranges from 30 to 40 beats per minute. So in front of you is a very simple presentation where you can see the increase in heart rate in pre and post training level when monitored on the treadmill. Now let's understand what is heart rate recovery, because this is considered to be one of the important cardiovascular adaptation. With training, the heart rate returns to the resting level more quickly after exercise. If we continue to train and condition our heart with aerobic exercises, the heart rate recovery will recover more faster as compared to a normal sedentary individual. The heart rate recovery is only affected in conditions such as altitude or heat. Now, first, before understanding what is heart rate effect, how does various factors affect the heart rate irrespective to the exercise, I would like you to introduce you to another very interesting term, that is anticipatory response. Now, what is anticipatory response? Anticipatory response is increase in heart rate. Increase in heart rate, which is usually caused by release of epinephrine. Anticipatory response occurs before an initiation of activity. For example, when an athlete starts to enter into a competition, you must have observed in the various competitions that they usually shiver out their hands or legs and shaken it well. So that is to cool down the anticipatory response, which has been released by epinephrine and causes increase in heart rate. Now, before activity, when the heart rate increases, this is called as anticipatory response. And this anticipatory response is intermediate through release of various neurotransmitters, most importantly, epinephrine and norepinephrine, which are also called as adrenalins. So let's understand now what are the factors that affect the heart rate in response to exercise. So the major two factors that affect the heart rate are large stroke volume and low heart rate factors. These are the two main components that are affected by the endurance training. Now, the reason of large stroke volume causing low heart rate is increase in the vagal tone and decreased sympathetic drive, which results in slow heart rate. Further, increased blood volume and myocardial contractility and compliance of the left ventricle is also responsible for increase in the systolic volume. Now, another dimension to this further cardiovascular response is increased systolic volume, which plays a very critical role in cardiovascular endurance. Now, this mechanism is called as increased systolic versus diastolic filling in response to systolic emptying. Now, this interesting composition is usually resulted from enhanced cardiac filling in diastole by more forceful systolic volume. Second, the neurohormonal influence, which is basically due to normal ventricular filling with a more forceful ejection and emptying during the systolic phase, is responsible for maintaining this ratio. Third, the responsible factor is the training adaptation, which is basically results in increased blood volume and decreased peripheral resistance. Now let's come to another interesting factor, that is stroke volume. Let me tell you that endurance training athletes have 60% greater systolic volume because of enlarged left ventricular chamber, which is also called as eccentric hypertrophy. Later on, I will let you know that what exactly this results in. So this is a very brief glimpse where you can see that the factors responsible for increase in systolic volume: plasma volume, filling time and venous return, and ventricular volume If all these factors increase, they will lead to increased diastolic volume, which is also called as preload. Further, increase in myocardial contractility. That means when the cardiac muscles become stronger, so they will contract more, and decrease in the total peripheral resistance. That is, when the resistance against the muscles and the forces is reduced. All these factors cumulatively result in increase of the stroke volume. So let's understand another very important dimension that is called as cardiovascular drift, which is basically result from reduced systolic volume and increased heart rate in prolonged exercises. So when a person or an athlete, they perform a subaxial exercises for more than 15 minutes, and they perform in heat when their core temperature increases, this altogether results in excessive water loss through sweating. Further, this fluid shift due to sweating from plasma and tissues further redistributes the blood to the periphery for cooling the body. Additionally, progressive fall in the plasma volume decreases the central venous cardiac filling pressure in order to reduce the systolic volume. Now, when the systolic volume is reduced, this initiates a compensatory heart rate increase to maintain a constant cardiac output as the exercise increases and the body temperature increases. Therefore, the cardiac drift describes the gradual time-dependent downward drift in several cardiovascular responses, most notably stroke volume during prolonged steady rate exercise, particularly during the high ambient temperature. Now I am coming to another important dimension, a very critical component of cardiovascular adaptation, that is the VO2 max. VO2 max, as you all know, is the maximal capacity of the body to transport and utilize the oxygen during exercise. Higher the VO2 max, higher the power output. Now, these are the factors that cause increase in the VO2 max in endurance training. That is, when there is excess of preload, when there is increase in the preload, which I have already discussed, decrease in the peripheral resistance, which is known as the afterload. Sympathetic and non-sympathetic activity decreases of the working muscle so that the adrenaline and non-adrenaline levels are maintained, will together increase the stroke volume. When the stroke volume increase, it will automatically increase the cardiac output. Now, when the sympathetic and non-sympathetic activity is maintained, it will allow more amount of blood flow into the capillaries and increased energy utilization, which is one of the peripheral dimension of cardiovascular adaptation. Both of these will together lead to increase in arteriovascular oxygen difference and thus leading to an increase in the VO2 max. Now let me give you a glimpse what are the basic level of VO2 max values are. In elite players, the VO2 max usually ranges to 84, whereas in female it results to 72. In distance runners, it ranges from 62 to 75, whereas in sedentary patient, it results from 30 to 35. In cardiopulmonary patient, it results from 12 to 15. So this also shows that there is a clear genetic predisposition for possessing a higher VO2 max, as males have a higher VO2 max as compared to females. Now let's understand, how does training programs have an effect on changes in the VO2 max? How can, with the help of training programs, we can have higher VO2 max and better efficiency? So if a person exercises on large muscle mass in dynamic activity for 20 to 60 minutes per session, 3 to 5 times a week, with an intensity of 50 to 85 of VO2 max, it will lead to better VO2 max capacity. Further, genetic predisposition, as I've already discussed, leads to 40 to 60% of VO2 max values. In addition, 50% of increase in the VO2 max is related to the increase in stroke volume, and 50% is due to the arterial oxygen difference in the sedentary subjects. So, to summarize, what are the methods of improving VO2 max is, number one, to have engaged in a program, exercise, which involves exercising the large muscle mass for at least 20 to 60 minutes, 3 to 5 sessions per week with a VO2 max capacity of 50 to 80%. The improvements will range from 3% to 50%. Scientists do say that 40 to 65% of VO2 max is related to genetic predisposition. Now, in this beautiful pictorial presentation, you will see changes in the VO2 max in concept to frequency, intensity, duration of training, and initial fitness level. So in picture A, you can see that as the intensity increases, there is increase in the VO2 max. But at one particular point, there is a plateau which was developed, and further which led to a downfall. Now next, the picture B shows the duration. So it says greater amount of exercises, the longer you exercise, the better VO2 max capacity you will have. Picture C shows a clear linear relationship with frequency and VO2 max. Increase in frequency of exercise will clearly lead to increase in VO2 max. And next is the fitness level. As said, better is the fitness, better will be your oxygen capacity. Another beautiful picture shows comparison of cardiovascular response of trained and untrained athletes. So in these various pictures, you can clearly see the efficiency of heart is greater in the trained people, which depicts in the form of pink color, pink line, whereas untrained depicts in the form of untrained people. So you can see trained individuals have a greater amount of efficiency on heart. Now, I have been discussing about arterioventricular oxygen difference. So let's understand how the factors affect this particular component. If we have to improve the arterioventricular oxygen, there has to be increase in the capillary density. This will cause increase in the circumferential area of the capillary, which will reduce the blood flow speed, not the rate. Second is the peripheral adaptation component, that is the increased mitochondrial count. The greater the capillary density, the more amount of energy is available for the cardiac system to adapt and utilize. So when more amount of energy is available, there will be greater amount of oxygen utilization, thus leading to higher oxygen and higher VO2 max. Now let me show you what are the blood flow, aspects of blood flow related to training. So there is an increase in blood flow with increase in training, be it of aerobic exercise or endurance or resistance. How it happens that exercise and training, aerobic exercise, it causes increased capillarization of the trained muscle, that is higher capillary to fiber ratio. Further, when we exercise more, there will be effective blood distribution. Thus, the blood will easily go where it is needed the most. Second, in endurance exercise, the blood volume will also increase. The red blood cell volume will increase and further will result in plasma volume increase. Thus, the hematocrit component will decrease. Further, changes in the plasma volume are highly correlated to changes in stroke volume and VO2 volume. The better the blood volume is there, more amount of energy is there, greater will be the VO2 max. So this particular aspect will show you the pre and post aspect of hematocrit component. As you can clearly see, greater amount of red blood cells in post-training and higher amount of plasma volume have resulted in lower hematocomposition in comparison to the pre-training levels. Now I will take you to another interesting composition, that is regulation of cardiovascular system in the neural control. So our brain center, mainly the medulla oblongata, has three important accelerator components. That is, the three centers are vasomotor centers, cardioaccelerator centers, and cardioinhibitory centers. Now the vasomotor center and cardioaccelerator center, they have a sympathetic outflow. They will result in the redistribution of blood, that is, the vasodilation and vasoconstriction. Further, the cardioaccelerator center also has sympathetic flow and will result in better and greater heart rate increase and better contractility. But the cardiac inhibitor center has parasympathetic flow, which it is controlled by the vagus nerve. So it will do just the opposite of the cardioaccelerator center, that is, it will decrease the heart rate and will decrease the cardiac contractility. Now, upon understanding the anatomy, let's see what are the factors that affect the neural control of cardiovascular function. Now, the higher brain centers are basically controlled by the cerebral cortex and hypothalamus. As you know, hypothalamus is the one that controls the body temperature, and cerebral cortex is the one that controls the motor components as well as the emotional factors. Now, both these components will affect on the medulla oblongata and the three centers, which I have already discussed. Now, these three centers are responsible for the mechanical flow and the metabolic functions. Now, the medulla oblongata is further controlled and contained by chemoreceptors and systemic receptors. Chemoreceptors includes pulmonary carbon dioxide, oxygen, and increase in hydrogen ion. Now, if there is decrease in pulmonary oxygen, it will lead to vasoconstriction. At the same time, the sympathetic receptors, the systemic receptors, basically composite of the baroreceptors and the stretch receptors. The baroreceptors and stretch receptors, they respond to the parasympathetic and the sympathetic outflow, whereas the stretch receptors, that is the right atrium, responds to the increase in venous return as well as the increase in the sympathetic flow. Now I will come on to a very important fourth component, that is cardiac morphology. Now, cardiac morphology is basically controlled by the law of Laplace. Law of Laplace says that ventricular wall pressure is proportional to pressure and the radius of the curvature, which simply means that it adapts to the various exercise programs in all the types of different athletes. Number one is the endurance athletes, which includes that greater than normal left ventricular internal diameter will be present in the endurance athletes since they do a lot of resistance training. Further, in resistance athletes, left ventricular mass will be 45% greater than aged mad sedentary controls, all thanks to the application of law of Laplace. Now I come to the most important factor, that is the resting cardiovascular adaptation, which in other words means how the cardiac system will adapt to exercise even when the person is not exercising and is at rest. So the resting heart rate will have either a very small change or no change, or the change will be in the form of decrease in the resting heart rate. This decrease in resting heart rate and decrease in the function is applicable to the systolic and diastolic blood pressure also. Further, stroke volume will have a slight increase when the heart is at rest or is non-exercising, whereas the systolic cardiac function and diastolic cardiac function will show no change. Now let's see what are the acute cardiovascular responses. So the acute cardiovascular responses can be further categorized in terms of two exercises, that is concentric and eccentric. Heart rate will increase in both concentric and in eccentric exercise, whereas stroke volume will decrease in concentric and increase in eccentric exercise. Cardiac output will increase in both the type of exercises. Systolic BP will increase more in concentric, less in eccentric. Same will be applied for diastolic, and intrathoracic pressure will also increase with both type of exercises. Now before you, I have prepared a schematic presentation where I want to show you effects of different training programs on the cardiac morphology of heart, like left ventricular mass, the septum, the left ventricular wall, the left ventricular volume, the left ventricular internal dimension at the end diastole. So you can see the left ventricular mass is increased maximally in case of resistance exercises, which is performed by the wrestlers. Further, the left ventricular volume is increased maximum in swimmers because they perform endurance type of exercises, which is a combination of both aerobic as well as resistance. And the left ventricular internal dimension is also significantly improved in swimmers as compared to the other form of exercises. Now I will take you to another important aspect, that is cardiorespiratory endurance. Now what is cardiorespiratory endurance? Cardiorespiratory endurance is body's ability to deliver oxygen effectively to the working muscles to perform physical activity. It is one of the most important components of health fitness. It helps to prevent hypokinetic disease, and it is concerned with the aerobic efficiency of the body. Cardiorespiratory endurance, how can we improve it? So if the person will exercise 3 to 5 times a week with an intensity of 60 to 90% of heart rate max, and with a time duration of 20 to 30 minutes, composing of specific aerobic exercise such as jogging, running, walking, dancing, cross-country skiing, if applicable, by biking and swimming. So they will certainly improve their cardiovascular endurance. So cardiovascular response to endurance exercise. Let's have a look on that. VO2 max, as you know, is the highest rate of oxygen consumption during maximal exhaustive exercise. So the endurance exercise increases the cardiovascular efficiency to about 20%, as the endurance exercise also increases the utilization of oxygen. The work rate also increases on heart, and there will be decrease in the heart rate at a relative workload. Now let's have a very brief picture and a clear summary of cardiovascular responses to endurance training. Consider this as takeaway messages that at the end of endurance training, what are the main cardiac changes that will occur due to exercise. So when you will have a chronic endurance exercise training program, there will be increase in the heart rate, increase in the size of left ventricle, which will lead to increased stroke volume, decrease in the resting heart rate, increase in the left ventricle wall size, no increase in the septal thickness, and increase in the artery wall compliance. In terms of vascular, we will have increase in the capillarization of all type of fibers, be it type 1A, type 2B, or type 2A. Hypertrophy of type 1 fibers, hematocrit values will be changed, and blood lactate values will also be reduced. Further, cardiovascular responses in specific to training will be that swimmers, if they exercise for more than, let's say, 10 weeks, so their response will be improved by 11.2%, which will be less in comparison to resistance training or strength training, because the cardiovascular response, as I've already discussed, affects maximally on large muscle group in comparison to the small muscle group. Now let's come to the cardiovascular adaptation from aerobic training. So aerobic training, as you know, will result in decreased resting heart rate, which is due to increased parasympathetic activity and decreased sympathetic activity. I hope you must have got by now with the help of the neurohumoral activity. Then there will be decreased submaximal heart rate, decreased maximum heart rate of elite athletes. If your heart rate is too fast, the period of ventricular filling will be reduced and the stroke volume might compromise. So that is why athletes, they train on a particular heart rate so that they can improve their stroke volume well. The heart rate expends less energy by contracting less often, but more forcibly than it would be by contracting more often. Further, decreased heart rate recovery will be observed. That means your heart will become less fatigued with the help of aerobic training. Also, aerobic training will lead to maintaining of cardiac output at rest, as I've already discussed. There will be increased cardiac output, increase in the blood flow due to increased capillarization, increase in the existing capillaries, effective blood redistribution, increased blood volume, decreased blood viscosity, and decrease in the resting blood pressure. Further, increased blood volume, as I have already discussed, is mainly due to plasma volume that is greater with more intense training activity levels. Now, this increased blood volume will also lead to increased release of antidiuretic hormones, increase in the plasma protein, increase in the red blood cell volume, and decreased blood viscosity. Now, let's understand what will be the factors that will affect this adaptation in aerobic training. Number one is the hereditary. Number two is age. The more is the age, the greater is the age, the lesser effect will be on VO2 max. Gender, I have already discussed, is one of the factors that contributes up to 40 to 60%. And last but not the least is the type of exercise or training that an athlete is performing. Now, this is the best and the easiest of all. Laughter. Laughter is more than a medicine. If you laugh and take it as a medicine, a hearty laughter helps the blood vessel walls to relax and consequently increase the blood flow for up to 45 minutes. So just laugh your heart out. Now, I am in brief going to discuss about the sudden cardiac death, which is related to hypertrophic cardiomyopathy. This condition is usually observed, though very rare, but in marathon runners and wrestlers. So exercise-associated acute cardiac events generally occur in individuals with structural diseases. Now, the causes of sudden cardiac death either can be structural or can be electrical. The most common structural component is hypertrophic cardiomyopathy, which can be functional also. Other anomalies, Marfan syndrome, left ventricular outflow tract obstruction, drug-related stimulants, primary and pulmonary hypertension, and commotio cordis are some of the diseases that are related to structural congenital efficacy. Now, this is a picture where you can see hypertrophic cardiomyopathy, which results in thickening of the heart. So to your extreme left is a normal heart, and to your extreme right is a hypertrophic cardiomyopathy heart that has entered into the obstruction. Last but not the least, from this topic, I would like to give you a very good home takeaway message. Cardiovascular adaptations with the help of aerobic exercises usually results in heart size where the walls get thickened, there will be increased ventricular filling and powerful contraction of the left ventricle. The stroke volume will increase at rest and during exercise, and there will be increased in the blood supply to the heart. Resting heart rate, as I've already discussed, there will be decrease in the resting heart rate. Cardiac output, significant increase due to increase in the stroke volume, and blood pressure, systolic, diastolic, both will decrease in the same. On a lighter note, I would like to share with you that red as well as white wine is just what your heart needs. Where the grape skin carries certain antioxidants that are kin to your heart, the grape pulp used to prepare white wine can boast of hidden cardioprotective compounds. So, on that note, let's take race to the toast. And I would like to end this session by saying Thank you to all the listeners. Stay safe, stay healthy, and please maintain the social distancing. Thank you.
Thank you, Dr. Jasmine, for the nice presentation. And we can treat our and we can decrease our rest heart rate, we can increase our stroke and we can increase our cardiac output. And definitely these exercises we can treat as we can treat any condition. I find out the exercise like this through which we can treat the total diseases, just like the hypertension, diabetes, and there are a lot of studies out there in which the hormonal we are the parasympathetic system in our body. If the parasympathetic system is promoted, then definitely a lot of diseases can be prevented. But if because being as a physiotherapist, we know what is the 60% of maximum heart rate and we reach the 85 to 30. But in general population, how doing? Because they won't be able to calculate of this thing. So what should be the exercise?
So actually this topic is something, if we go in depth in detail of this topic, we can understand that this cardiovascular fitness is basically divided into two aspects. One is the cardiac aspect, another one is the peripheral aspect. Now, in terms of if I have to explain it to the listeners, it will be easy for me to tell them that with increase in aging, it is very important for us that what to do, how much to do, and exactly what to eat. Because the peripheral aspects are basically influenced by our diets, what amount of energy is available in our body. And the cardiac, the central aspects are controlled by the cardiovascular system, how our brain and our heart are integrated with each other. So that can be easily influenced and controlled with the help of exercises. So why we focused on aerobic exercises today? Because aerobic exercise is one form which you know better is applicable in all kind of generations, in all kind of people, be it diseased, be it non-diseased, be it healthy, be it completely sedentary, be it child, or be it a senior citizen. So in a crux, because it's a very heavy topic, I didn't want to create a boredom of a session. So I just wanted to sensitize and influence the listener and create a awareness that whatever amount of physical activity you involve in, you will add ages and days to your living. And that too, it will result in healthy living. At this time of lockdown, where we are sitting inside the home, the lockdown doesn't imply that you have to sit inside a room. Lockdown implies to maintain social distance. I think the objective of this session, which you are dealing with, is to create sensitization so that people, even when they are staying at home, can stay healthy, can stay happy. And as one of the important composition is laughter. So I think if you can do any sort of physical activity, which will be aerobic in nature, will add good ages to your life, will prevent you from aging, will prevent you from all the diseases.
And Dr. Jasmine, exercise could be affecting on the visceral fat also, in the fat reduction also.
So actually, I'm unable to hear you. Probably
it would be able to reduce the weight of the person. It would be able to reduce the fat, visceral fat of the person.
Sir, if you don't mind, can you please type it, because I'm unable to hear it completely.
Okay. Dr. Dharam, can you listen me?
No, your voice is breaking, sir. You just
okay,
come closer and speak.
Yeah. So I was asking that this exercise is aerobic training will help in reduction in the weight during the lockdown or not?
Sir, all I can hear is you are asking me which kind of exercise a person can do during the lockdown session. Am I right?
Yes, sir.
Right.
Yes, ma'am.
So, yes. So, sir, as the topic you have chosen for today is aerobic exercise. So, aerobic exercise at home is applicable in the form of walking, simple walking around, in the form of stair climbing, a quick walk in the form of jogging or brisk walk can add ages to the aerobic exercise and effective cardiac composition. Further, if a person can involve in some amount of resistance training in the form of gardening or in the form of washing clothes even, that is also a form of resistance exercise. The combination of walking and doing some basic household activities will make it an endurance exercise, and that will give you better benefits to your cardiovascular efficacy. So in this manner we can prevent any cardiovascular complication to set in.
Thank you, Dr. Jasmine. Thank you for the wonderful explanation. With this note, the takeaway messages during lockdown, we have to do exercises at home and the aerobic training
Yes, absolutely.
during this time.
Even if somebody is not comfortable in doing walking or household activities, if you have faith in yoga, you can perform simple yogic activities, simple pranayam, simple breathing exercises. I can definitely say you that will add ages and that will add better efficacy to your own system. You will prevent yourself from various metabolic conditions, and you will have a better cardiovascular adaptation to any soft form of exercise. Most of the patients who are coming nowadays, other than corona disease, are having complication of poor gastrointestinal efficacy, are having complications of breathing. So I think aerobic exercise in any form, be it yoga, be it good laughter, be it walk, be it doing some household activities, can lead you to a good and a better life.
Thank you. With this thing, definitely we all the physios and the students, we will be doing all this exercise. Thank you, Dr. Jasmine, for giving us a wonderful lecture. Thank you.
Thank you so much. It was a pleasure. I hope I could live up to the topic you had chosen, because you had certainly shared that this is very close to your heart.
Yeah,
So I hope
definitely.
I was able to deliver.
Yeah.
So I hope I was able to deliver justice, and I hope
Yeah,
listeners
it was
who are
the
there
full
are able to understand. Yes, sir. So I hope I am able to share whatever knowledge I had in the simplest manner, so that you can, the takeaway message is, the better active you are, the more active you are, the better heart you have. A healthy heart is a way to a active life.
Yes, ma'am. That's the main takeaway message. Healthy heart.
Yes, sir. Certainly.
Thank you, ma'am.